Hello, everybody. This is Keith Caldwell. I have with me Dr. Belinda Daughrity. Let me tell you a little bit about her. You guys know about me. Belinda is an assistant professor and a licensed speech language pathologist based in Los Angeles. She completed her BA in English and Spanish at Spelman College, her MA in speech and language pathology and audiology at New York University, and her PhD in education with a specialization in human development and psychology at UCLA. Now, I'm a Berkeley person, so down Bruins. Belinda's clinical and research expertise are in social skills and parent involvement with children with autism spectrum disorders, as well as barriers to early access to diagnosis and treatment of autism in communities of color. In addition to teaching, she continues to work as a bilingual speech language pathologist and a clinical supervisor for training clinicians in clinical and telehealth settings. So, as you can tell, Belinda is awesome, and she's been working with my son for 3 or 4 years or so, and huge, tremendous progress. So with that, I'll let Belinda take over.
Okay, hello. Hopefully everyone can hear me just fine and see me just fine. I just want to thank you all for attending today and for checking into this webinar. I got my doctorate at UCLA, but I'm not a Bruins fan, so I take no offense to that. I am much more, if I had to pick one to really go for, it would be Spelman. So everything else is fine. So I just wanted to thank you for that introduction, and then I'm going to share some slides with you all as I get started. But before I do that, I just want to get a feel for who is in the room exactly. So if you can, I'm going to do a quick poll here that should be easy enough to see. Let me make sure you guys can see it on your end. Let's see. It's just going to ask you, I just want to know who's in the room. So if you're a parent, if you are a professional, or if you are neither of those, just so I can have an idea of who's attending. You should see the poll come up on your screen. If you don't, that's okay. We'll keep going. If you guys can see that, just want to know if there are a lot more parents than professionals here.
We got some, and people are commenting in the comments too. Some people are saying parents.
I see in the chat. Okay, I see. Okay, so let's see. I'm going to go ahead and share my slides with you.
Now, I did, Belinda, invite some professionals who work with my son at his district who are excellent. As you know, you've worked with a lot of them over the years.
I have, yes, I have.
I know that they're going to be here.
So let me share my screen.
All right. Hello, Dana. How are you doing? I know who you are.
Okay.
All right. There we go.
So here we go. So today I'm just going to be talking about speech language pathologists and telepractice.
Hey, Belinda, real quick, it looks like it's about 50-50. We got some professionals here and we've got some parents here. So
got it. Thank you. Thank you. So we'll go over how to set up your child for telepractice success. In this sense, I'm talking about child as in if you're a parent for your child, and I call all of my clients, those are my kids. So how to set up your clients for telepractice success. And then how to develop effective materials for engaging intervention. This is something that a lot of my own colleagues had a lot of difficulty with when we were kind of conceptualizing of this initial transition, particularly for those who hadn't worked in teletherapy before. So how do you use materials? What do you do? How do you get them engaged? And so I'll touch on that a bit. And then lastly, but really most importantly, is how to establish kind of buy-in and parent partnerships that are essential for successful service delivery. So in our current modality where most of us are working from home, the relationships between clinician and parents really becomes paramount to make sure that the service delivery is successful. Prior, I had done teletherapy in schools, so I would be from home providing teletherapy to children who were in schools, largely in rural areas in California, but also in schools and districts where the on-site speech language pathologist was overwhelmed and had too many cases. And so they needed to outsource some of that. So I've worked both in schools and in homes, but now since we are all from home, I'll talk more about how to build that relationship with families, although prior I used to talk about how to build that relationship with paraprofessionals in schools, classroom aides, speech language pathologists, etc. I'll just touch on what our role is as speech language pathologists. So we need to understand and be able to apply the appropriate models of technology used to deliver services. And it seems kind of, this seems like an obvious component, but this was something that was quite a struggle initially for a significant amount of speech language pathologists, is understanding how the technology works, understanding how to utilize services and platforms like Zoom in order to make them engaging, understanding how to comply with regulations for privacy, all of those sorts of things. We're also charged with then collaborating with physicians or other practitioners. These are our typical scope of practice guidelines that we might collaborate with another speech language pathologist or with a student's behavior interventionist or other people who work with that child in order to make sure our services are really most applicable, that we're really kind of holistic services to that child. So I've kind of highlighted a few things that I think are most important for teletherapy. The first is training and using support personnel appropriately. So currently that predominantly will consist of parents who are at home and helping their children either transition to teletherapy, meaning sitting them in the space, making sure everything is working appropriately. In schools, that might have been paraprofessionals doing that job. I've also worked with behavior interventionists in the home, and perhaps their role is to fill in that caregiver role of making sure everything's working and that the child has access to everything and everything's appropriate. We're also charged with maintaining appropriate documentation. So even though this is therapy delivered via telepractice, we're still expected to document those sessions the same as you would for face-to-face sessions. One of the things that's important as well is just confirming that everyone is clear that this is telepractice. In your documentation, I'll give an example of this a bit later, you should document how the services were delivered, meaning that it should state that telepractice was the modality. Really, most importantly as well, we need to select clients who are appropriate for assessment and intervention services via telepractice. And I'll touch on that a bit later, because while telepractice, I have worked in this sphere for the last 5 years, it is certainly not for everyone. It is not appropriate for every client for assessment and for intervention. And so you want to use your best clinical judgment to determine who can best benefit from teletherapy services. So one thing to consider is the licensure requirements. So teletherapy is at present restricted to licensure requirements where both the clinician and the client have to reside in a state where the clinician has a state license. So I am licensed in the state of California. That means I cannot see a client who is in Illinois or in Georgia. I can't see those clients because I'm not licensed in their state. And so that's something to keep in mind if you're looking at either finding a teletherapy clinician, or if you're interested in servicing clients, you have to be licensed in the state where you reside and the state where the client resides. And so that's important. Privacy is also something that's important. So similar to our HIPAA regulations that we have when we have in-person traditional face-to-face sessions, you cannot do teletherapy via FaceTime. That's not a secure platform. You can't do teletherapy via Facebook, right? So you have to pick a platform that is secure. Zoom, GoToMeeting have been platforms that have been used for quite some time. And those are just examples. But you want to select a platform that has a high-speed internet capability and a working camera. So those are two of the kind of key ingredients to cut out any of the tech issues that are sometimes common. Added privacy is important. So if you're working in a busier space, headphones are suggested. When I used to do telepractice services in schools, generally my students would be assigned to like the teletherapy room, and they would have little cubicles, and there would be several sessions going on at the same time. So both the client on their end would have headphones so that they weren't as distracted by their classmates who were also receiving services at that time. In general, you want to have like a quiet space, something that's going to be conducive for conducting therapy, the same as you would in face-to-face. So you wouldn't give speech therapy in a Starbucks per se. So you want to make sure that your home environment or your working environment is similarly set up. Clinically, we are bound by the same ethical guidelines with privacy and confidentiality that you are in traditional face-to-face settings. So when I suggested some of those platforms to use earlier, you're thinking of things that are password protected, that allow you to de-identify, that are invitation only. You'll notice that Zoom in the last few months has made quite a few updates. Things such as invitation only, password protection, waiting room enabled, things that allow for even more privacy concerns.
Hey, I have a quick question to
clarify.
Is everybody seeing the public chat? Just because I'm getting a couple comments from people saying they're only seeing that. I don't know if you people are seeing that. And also, I had okay, so she is seeing that. Anyhow, and I also got a comment. Is there going to be parts relating to parents as well?
Yes.
Okay.
Okay, so when we think about sessions, things that you want to set up, and this is both as a clinician and as for parents, is you want to make sure that you're in a space that allows for concentration, right? I think this is something that we've learned over the last few months is really important, that it's hard to have your Zoom session or Zoom class while the TV is going or while a sibling is, playing right in front of them, right? So there are ways to set up your spaces in your home environment to make sure that it's just minimal distractions and kind of lends itself to high quality engagement. When we think about collaborators, we want to collaborate with members of the support team as appropriate. This is important for parents as well, in that really I consider parents or caregivers to be our most important kind of team member, right? So parents have to both communicate what their needs, their wants are for intervention, and also kind of make sure that they're receptive to what is being conveyed to them. And I think that is a two-way kind of street. So interventionists need to make sure that they're communicating appropriately and often with parents. And then parents have to make sure that they're open to being communicated to. So you should communicate what your best mode of communication might be. So I have parents with whom I'll email updates once a month because that's their preference, or I will give them a breakdown at the end of every session if they're going to sit side by side with their child, and I'll kind of break down exactly what we did and how things can be carried over in the home environment. But you want to make sure that there's an open line of communication there.
I want to elaborate on that because I think it's really important for parents. I mean, you've been working with us for years now. So we have a system. There's two households. My ex-wife has a household. Belinda speaks to them at that time, but we are all engaged in my son's delivery. We work with Belinda. We work with his school speech people to make sure there's continuity between what is being taught here versus taught at school versus taught in both households. Yeah. So that communication is very important, and to reiterate and reinforce what's being taught in the school and here in his private sessions as well. So that collaboration with parent is critically important.
100% agree with that. We've talked about location. This is important for parents at home. I know we've all scrambled in the last few months of trying to create spaces in our home to lend itself for school, for learning, for work. And so we're in a space hunt in our own homes. And so trying to find spaces that have adequate lighting, that allot for privacy, reduce distractions are going to be really important. Trying to reduce the visual overload. You'll notice that my background, I try to work somewhere that has a blank wall as much as possible. For children, I suggest sometimes facing them toward the blank wall and having the computer there so that that is all they see, as opposed to seeing all of the options that might be in the background that might also be interesting, like their iPad in the corner or, a puzzle or whatever toys that they usually have. So reducing the visual overload, I think, is really important. In addition to just making sure that everything is working, right? So Zoom might have an update, and just making sure that all of those things are up to date and working prior to getting started. Here, I'm just, kind of reiterating that you can have intervention delivered really in any space, right? That where the client can kind of focus on the screen and focus on intervention. So we've had, as was mentioned, I see a client and he's seen in 2 homes, right? And that's his typical. And so that's a typical point. I've had another client who is seen in his home, but he doesn't have his parents there available. He has his behavior interventionist, who is my primary communication partner in delivering intervention. So there can be a number of settings, and there's no right or wrong. It just needs to fit for that person. And so figure out whatever works best for you. So just as a caveat, I just want to add that telepractice is proven to be as effective as face-to-face kind of traditional intervention. And so when you see EBP here, that's evidence-based practice. So there have been articles looking at and studies looking specifically at outcomes for telepractice. And findings have shown that children can make as much progress in teletherapy as they can in face-to-face intervention. I'll add to that, however, that it's important to determine if your child, your client, is appropriate for teletherapy. And I just want to reiterate that again, because you'll find that it is not a modality that necessarily works for every child. And so while it can be as effective as traditional intervention, I think the underlying kind of current of that is that the client can thrive within that type of modality. And I will touch on that in just a bit, of kind of how to assess whether or not your child or your client would be a good candidate for this type of service. So the first point here is looking at behavior needs, right? So if you're thinking, oh, well, my child has a really hard time attending, or maybe they have some more aggressive kinds of behaviors. I don't necessarily say that clients with behavior needs are not good candidates for teletherapy. I think I've really kind of come to the point with my own practice that I believe everyone can have a trial of teletherapy that I think is worth having for at least, I would say 2 weeks tends to be my trial period, and then to reassess if that's a method that's going to be productive. When we think about behavior needs, we have to be proactive in behavior. You'll see an example in a bit of one of my own sessions with a client, but you want a lot of verbal praise, a lot of positive reinforcement. I incorporate visual schedules as appropriate. You really have to be proactive in your behavior needs. If there are kind of sensory-based needs, you might have a parent or caregiver next to that client who is providing sensory input or giving kind of breaks. I've worked with clients and I said, okay, let's stand up and let's, jump up and down 5 times and then now sit back down. But giving those types of breaks so that they can attend to the structured task.
I'd like to add to that. So when you're from parents, when you're hearing these kinds of suggestions and comments, look at it from your perspective as well. So know that these are the important characteristics that you need to be looking for when you're looking for and finding a speech and language person that you can work with. So they need to be available and be able to do these things, and you should be aware and be able to ask these kinds of questions. So just make sure that we might be talking more specifically to clinicians here, but reverse it, knowing that if you're going to be working with a clinician, that they should be versed in these things, or it may not be a good fit. So we as parents are used to doing the extra work, so it's just another area that we have to do it.
Great. So again, just kind of looking and making sure that your client or your child is an appropriate candidate for that type of service. So I will give an example of a client who I worked with who was not a good fit for telepractice. So he was 3 years old, had some sensory needs, and had some receptive and expressive language delays, but could not sit in that chair or on the floor for that session for, even 10 minutes at a time. And so with all of the redirection required from the parent, I said, you know what, I think he's a better candidate for face-to-face intervention. Things that you can work with face-to-face that you can't work with in teletherapy, which are manipulative-based objects, toys, Play-Doh, things that might keep his hands and his body more active, that is not conducive to a teletherapy setting. So you always have to keep individual client needs in mind. So setting up a partnership with your clinician or with your parent. One of the things that I think is really important is your materials really have to be selected prior to the session. You want to reduce the visual clutter. We've talked about this before. I will show some examples, but I've used great materials that are just online options. I've also made my own materials in PowerPoint or in Word documents, but it really allows you to kind of individualize therapy and make it your own, which we do anyway in our typical face-to-face sessions.
I know that with my son that you've used pictures of his brothers, his sisters, and me, and so he can sort of see that. Is that what you're referring to?
Yes. So I've used pictures just generally from, if I'm working on actions, I'll pull out a bunch of different action pictures from Google Images. But I've also used personal pictures from clients to kind of facilitate, oh, what did you do this weekend? And they went on a vacation, and so they sent me photos. And so I'll have my clients recount what they did using visual clues from their own kind of repertoire of photos from their vacation and their outing. So those types of things can also be really helpful. They see themselves reflected, they see their family. And so those are things that can help to get the clients engaged and help to get your child engaged.
I want to add to that just real quick too, because this was really helpful for me, and I could see it being helpful for other parents as well. When my son was going to Hawaii last year, you and his speech language person from the school, you guys put together a curriculum between the two of you guys to say, this is what it's like to be on a plane. This is what it's like to have a stewardess come up to you and ask you for stuff. So he was prepared for all of this. It was so awesome that you can find a way when you're working with someone to sort of help you have a more natural experience, because I was really terrified of taking him on that plane for this first time. I was like, oh Lord, is this going to be a nightmare? But he was ready for it. So that was good.
Yeah, I think that's a great point. I think that really ties into the partnership piece of communicating what your needs are, what the kind of upcoming events are, and how that can be tied into speech and language sessions. And I think that was a great example of that. So I'm just going to show an example of what a session might look like that doesn't include materials, right? So again, I'll show an example here. This doesn't have any kind of materials with it. It's just working with face-to-face conversation with reciprocating social communication questions. So let's take a look at this one.
That's my little guy. I can't hear it.
Oh, you can't hear it as well? Try to turn it on. Is that a bit better?
Yeah.
So I'm going to pause it here. So you'll see here, there's no kind of screen share. There's nothing pulled up. He's very well attended at this point. He's been with me for several years, but he actually doesn't have someone who sits right next to him. He used to when we first started, but he's so acclimated to this system. He sits there on his own. He will go and, solicit help if there's some type of tech breakdown, which happens once in a blue moon. So again, this is an older client, so we don't need as many materials, right? But you can certainly have sessions that don't include a lot of media or a lot of additional items in order for it to be successful.
Who's that good-looking guy sitting on the couch over there?
One of the things I also think is really great too, so you'll see, you know, a lot of times when you're working in someone's home, and I used to do in-home therapy in my early days of clinical services, you know, you get the opportunity to work with so many different people in the home, right, who are generally there, whether it's grandparents or caretakers or siblings. And so I think a lot of teletherapy brings back that same effect, where you're able to work with other people in the environment. And I think those people also get to see what it is that you're doing directly, which is sometimes, you know, really hard to do in the school-based setting. Every once in a while, you might take a video of a session and share it with a parent, but it's different when they are hearing exactly the input that's going on and they're able to support. So here I'm going to show an example of what it might look like with materials. And this is an example where I'm using just a simple PowerPoint. And I'll pull up in just a moment a couple different examples of PowerPoints that I've used. Aside from PowerPoint, I've also used my kind of go-to are movie trailers, which I love. They're short. Particularly if you're working on WH questions, you know, you can make them increasingly more complex. If you're working on emotion.
Working on what questions?
WH questions. So things like who, what, where, right? Being able to respond to those types of questions.
Okay.
And so movie trailers are my go-to, right? They're popular, they can be new, right? Whatever new kind of children's movie is coming out, I'll pull up the trailer and say, oh, what do you think is going to happen? And they love those materials. So that's just a thought. Share this here. I'm just going to zoom this up a little bit. So you'll see here I'm using a PowerPoint. I've pulled up, these are images that I just pulled from Google, right? And I'm using this, I believe at this exact moment, to work on pronouns and WH questions of what, doing, and where. Okay.
That's really hard to hear, Belinda. I'm not sure that's going to work.
Oh, no. Okay, let me see. So what you'll see here, he's, again, pretty well attended, kind of attending on his own. I'm pulling up, I have these pictures kind of laid out in PowerPoint and he's able to respond to them. You'll see my use of visual cues. I'm doing this for him because we're working on making our sentences longer. And so rather than me jumping in, I gave a visual cue and he would add on to the sentence to add more detail. You'll notice that the same type of cues that you would give in traditional therapy, face-to-face, is the same type of cues that you give in teletherapy. And then I'll just show
you. Might be helpful. I don't think the audio is going to work through
the audio is a little low.
You might just need to explain what's going on in there.
Yeah. So that was I only had 2 of those. So I just want to kind of show, I'm going to skip ahead just to some pros and cons. So of teletherapy itself. One of the things I love is the lack of commuting, right? This used to be something
yes.
loved before. And now in COVID, I would die to commute somewhere and have somewhere to go. But, especially in Los Angeles, just the traffic and access, just not having a commute. I love just being creative and individualizing intervention, which you're able to do face-to-face as well. But I just love the newness of it. It feels different. I also, really promote the options for clients. So when I did teletherapy in schools, it was almost exclusively with bilingual clients. I'm Spanish English bilingual. And so I did quite a bit of assessments in Spanish. And so the idea of access, right? So not having access to a bilingual clinician at whatever school environment they were in, but being able to utilize telehealth to give access to a whole group of students who otherwise would not have had a bilingual clinician available.
Hey, Belinda, let me ask you a question because Kathleen just asked it, and I think it's important. Kathleen, my son, when he first got started, even maybe before Belinda, was essentially nonverbal, maybe one-word utterances, just very limited language. So teletherapy, telepractice does work with nonverbal. It's just a longer cycle. What I liked about being able to find someone like Belinda out there is that I was able to find someone who's an expert in his deficiencies. So that gives you the ability to find someone who doesn't necessarily live in your hometown or is at your school to expand that kind of skill set. So I was able to find someone who's ideal for his deficiencies. So yes, my son had one-word utterances, but now he's answering who, what, when, where questions, and he's asking questions. He's bossy. He's telling he doesn't want this, he wants that. I mean, I love it and I don't love it because now he's becoming just like a typical kid. So I was there, Kathleen, is my point. And yes, teletherapy does work even for nonverbal with reinforcement from the parents. So yes.
I think that's a good point just for me to emphasize as well, that it's not exclusively for children who are highly verbal. He just talked about his kind of journey with our son at this point, but he was using 1 to 2 words when he first got started, and now he's like expanded into sentences. And so I've also worked with clients using teletherapy who are using AAC devices, who might be using an iPad to communicate. So it's not something that is exclusively for kind of this low behavior need, highly verbal population. It can be really for individuals across the spectrum. And so I think that's really important to kind of consider, which is why I discourage people from, kind of on the outset saying, oh, that would never work for my child. I really think it's worth trialing to see if it can be effective.
Well, I will say unequivocally that it can be effective. I remember thinking 5-6 years ago, and some of the people on the line here were his speech language people. They know from back in the day that our issue at all of our IEPs has been speech, speech, speech. And I was at some point in my past wondering, am I ever going to hear my son say, I love you? And now I get to hear all that and more. So
his demands.
And I love it. I don't want gummy bears. I want gummy worms. Okay. So this works is what I'm saying. And that's why I wanted to have this. Yep. Let me ask you a couple questions that are coming in.
Yep.
Valerie, I'm assuming you're here in California because you're asking the question about regional center. They wanted to know, Belinda, are you able to be contracted through regional centers? Are you working with the regional centers as a speech language person?
Yeah, so I am not contracted through regional centers. I personally only work with private clients at the current time, but I do have some resources for people. If they do have regional center services, I have a great clinic that I've also worked with and still work with that is contracted through regional center and through Kaiser and Easter Seals if you're in the Los Angeles area. And then if you're also in the Los Angeles area, I work as well at a university. They have a university-based clinic that is offering telehealth services in the interim while we're here. And so if you're interested in that, those services are actually free of charge to families regardless of income or insurance. So there are a number of options, and I'm happy to share those. Any other questions? I just wanted to thank everyone and get to your questions. My email is here, just a reminder to keep your mask on, right? So hopefully this can end sooner rather than later. And then I will take your questions. Come out of here, there we go. Any questions that you all might have? And let me go to the chat. Okay, Oh, a resource list. Sure, I can actually get that to you. I'll follow up with Keith to get that sent out, a list of resources. Another question about how do you conduct a good teletherapy assessment? That's a great question. So a number of the tests that we use in speech language pathology are also available digitally. So I'm assuming, Valerie, if you're a professional, if you're a SLP, I'm assuming, you're asking about assessment. But, and I'm going to type in the comments. This is my email. I see that other comment there. So there are a number of assessments that are available digitally, and as long as they're available, you can deliver those. So I have given, for example, vocabulary tasks, any type of picture naming task, any task that uses a standardized manual of photos, that's what you can deliver digitally. You cannot give a test that really takes a lot of materials to give. So something like the preschool language scales, the PLS test that has a lot of items and toys, that's going to be really hard to deliver in a standardized way. But you could certainly do dynamic assessment. That's
VPN connected.
Parent training, parent intake, all of that can be done via teletherapy.
As you see, I'm having some technical issues.
No problem. I've done this before, so I'm navigating the chat.
So I apologize for me, guys, but Belinda is in charge, as she always is.
And I'm looking at capacity through regional center, associate services available to adults. I do. I will put a suggestion in this chat for regional center. I don't know, Valerie, if you are in the Los Angeles area, but I will.
So as you're typing that,
the suggestion.
When I logged out or got kicked out and came back in, all the chat's gone, so I don't see any of this that you were talking about.
Oh, okay.
Fine. But I had put a link in there to ASHA. Is it still? Could you put that in there again if people aren't seeing it?
Sure. Yeah. So, and I think earlier the link was provided to ASHA ProFind. You can Google that as well, and I'll put the link in here. That will pull up different providers in your state and city. So you can look at specifically for your area to try to find a provider that way.
And I had a couple questions I want to ask you before I get kicked off again.
Okay.
That I found helpful. So as the host, I get to ask my questions.
Of course.
So, you know, we've worked with you before, and I think it's been super helpful to collaborate with his school professional to collaborate on goals. The IEP goals. And I don't know where everyone's in terms of if they have kids that are in school, if they're out of school now, but to have someone you're working with that's working with the kid face to face and put together that, do you have any recommendations on best practices about goal setting or any of that kind of stuff you want to talk about?
Yeah. So, you know, when you think about goals, you think about them in a holistic way. So sometimes schools have goals that have to specifically address the academic curriculum. That is not the case in private therapy. So in private therapy, goals can address things that are maybe more personal to the client that aren't necessarily academically related. And so it depends on what your needs are, what your wants are out of therapy. And you can really decide kind of which goals fit best for you. So something like being able to take a trip on an airplane might not be something directly related to the academic curriculum, but personally to that family was really important, right? So that is something that I was able to really focus on in my private sessions as opposed to in the school environment, although they were able to support that.
Mm-hmm. Yeah, absolutely were. Now, for people who may have, I wish I could share it with you, but she didn't give me permission. But I got an email from an 85-year-old woman today who her son is 58 years old. And she was just super thankful for what we're doing and all this kind of stuff. But the reason I bring her up is there are people who have speech issues that are no longer in school, so they're not talking about it. So do you have any suggestions or things relative to how to engage with older individuals with speech challenges?
Yeah, I think, Unfortunately, there is such a cliff after high school, and that's been talked about for years, about kind of what services are available to young adults or adults who have autism or have speech and language delays. And so one of the things that I have suggested often is looking into pre-vocational based training programs. Those are sometimes offered via school districts and also via regional centers or via, particularly in California with the regional center system. I also suggest a lot of times parents do like to continue speech and language intervention services to work on different types of needs. Sometimes the frequency of those might be less frequent as individuals get older, but sometimes that can be something that helps to kind of serve a function of continuity and helping the client to adapt to whatever their new setting might be outside of school.
So what about, how do you evaluate as a parent whether someone is a good fit for you? Is there things that you should be looking for? Like, this person doesn't know what they're talking about. Are there things that parents could ask a professional to engage, to decide if they know what they're doing and would be a good fit for their kid?
Sure, yeah.
Well, fortunately for me, all of my son's SLPs are excellent. The ones listening and the ones in the audience. So.
Well, I think, I think it's important to, in any regard, to see if your relationship with your SLP is a good fit. It's sometimes it is not. So, and I have, had lots of experience where I have suggested, when I worked in an office, I would say, oh, you know what? I think this clinician is going to be a really good fit for this client, because I think, her style and would really fit to the mode of this child. However, clinicians really ourselves need to be able to be flexible and adapt to what the client needs. So when you're looking for fit, you really want to communicate with your child's interventionist, what are some things that you think as a parent have worked really well for them? And that clinician needs to be able to adapt. So part of our job, part of our scope of practice that's ethics for us, is that we adapt our style, adapt our approaches based on client need.
Is it appropriate for us as parents, this is sort of a rhetorical question because, I do it anyhow, but is it appropriate for us as parents to ask for, and receive an update from our telepractice professionals and say, hey, let me know where we're at, what we're working on, and what I can do to assist? Is that expected? And
yeah, I think that's definitely something that really helps to promote services and helps to promote the skills generalizing outside of just the teletherapy room, right? So it does me no good if my client does a really good job in here, but then they, exit program and they don't engage in their typical environment. So asking parents, hey, we've been working on reciprocating social communication questions. When he goes to basketball practice, can you give me an idea if a peer comes up to him, does he say something back, right? Those are the types of things that help me to know whether or not what I'm working on is working and is effective.
I have to give an aside because this was so funny. So we had been practicing with my son, Belinda, and his speech person over at the school. I'm not going to say her name because she didn't give me permission to do it. But and we've been working on, communication. Someone says hi, you say hi back, and hello, how are you back? Well, anyhow, he was at basketball practice, and this cute girl walks up to him. She goes, hi, my name is blah, 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 blah. He's like, forgot everything. I'm not sure because it was a cute girl or what, but I was so touched by that.
Yeah, and just hearing all of the feedback, I think, is really important. So we talked about before when we were first working on that he went overboard with it and was doing it to everybody, like in strangers in the line at the movies, and they were like, I'm trying to get somewhere, and he's still talking. And so then we worked on, okay, well, who do I have a conversation with? So. Right. Again, thinking about, we can only work on those goals if we're getting that feedback from the family so that we know, how things are working in the real world. And so how can we tailor what we're doing so that we can better help?
Yeah, that's how I found it to be most useful for us, is that, yes, he's learning at school, but he's learning according to a rigorous curriculum that they're sort of, whatever. But there are certain situations like, hey, we're going to be going out to the park, and he needs some language revolving around that, so he can go up to kids he doesn't know and say, "Hey, I'd like to play with you." So that's how I sort of use the private speech.
Yeah. Yeah, I think I would agree. And I think we've had quite a bit of success, and I've been able to work with, like I said, I've worked with clients in schools, I've worked with clients in homes. Right now I'm working with a client who I'm predominantly working with the behavior interventionist actually to work with her cueing and modeling to try to stimulate speech. So I'm essentially, training what we do, which is, kind of like an in-service kind of training that you might consider in working with other providers who are working with kids, particularly during this time, because some of our clients don't have the ability to get to face-to-face, particularly if teletherapy is not an effective modality for them.
I'm trying to find that ASHA site. Did you put that in there?
I did not.
I'm trying to get it here. So, Kathleen, the list of providers is ASHA. I don't know what that stands. What does ASHA stand for?
The American Speech, Language, and Hearing Association. I know we have a lot of acronyms in our field and a lot of long titles.
So that's the place where all speech and language people are listed.
Sure. So I say that with a caveat. So it's not necessarily all, right? So if I think the other day I looked up Los Angeles just to kind of take a look, and it was like 80, and I know that's not true. So, there are significantly more, not everyone's listed there. And I would say that not all of that information is kind of always up to date, but it does give you some place to get started. And I think that in itself is helpful.
Valerie is asking, have you answered this already, worked much with developing reliable yes-no response beyond replies involving preferences?
Oh, I did not see that question. And that's interesting that you bring it up. That's actually exactly one of the goals that we're working on right now, right? So working on being able to say yes, no to something that he prefers. So
hold that thought. Kathleen, you're saying repeat what? Can you type that in, Kathleen, as Belinda's talking? Go ahead. I'm sorry.
I saw that, yes. So that is definitely something that can be targeted. I've worked on that with other clients. So I'll have, again, input from parents on what their preferred kind of items are, and then I'll have a foil, right? And I'll say, oh, which one is your favorite? And if they answer incorrectly that I know pretty accurately, then I can target that as a goal. So saying, oh, do you really like spinach? Or do you prefer cake? So trying to get them to express what their own preferences and their own opinions are. And that's something we're actually working on now.
Right, because my son says yes to everything, but the other day you asked him, have you ever had pad thai before? No. We're like,
very pleased. Yeah. Because I will throw out, just all types of things. Oh yeah, I like squid and I love sushi. And he's like, me too. And I'm like, you have never had those things. And so I have to work on him being able to communicate his own preferences and opinions, which I think is something that a lot of our clients work on, but that's something that's an ongoing task.
Hey guys, I want to let you know we're approaching the hour. So if you have any questions, get them into the chat line so we can make sure Belinda gets to them. Kathleen wanted to know what ASHA stand for again.
Oh, it is American Speech, Language, Hearing Association. When you're looking for providers, you do want to ask if they're ASHA certified. That's our kind of national body. And so that generally means that someone is licensed. You're looking for a licensed provider. So you should see a lot of letters after their name, which is what my own friends will say in my email signatures, right? So yes. Belinda Daughrity, PhD, CCC, SLP, right? A lot of letters. That CCC is important. It means that you have a certificate of clinical competence. It means you're really at the end of your kind of program as a speech language pathologist. Your past training that you're certified. If you see CF there, that usually means that that person is in their fellowship year. So they've gone through school and now they're in their 9-month fellowship program, but they're not licensed yet. They're on their way to being licensed. So those are some kind of designations that you might want to ask about. If you see SLPA, that means that they're a speech language pathologist assistant. So they are not a speech language pathologist, but a speech language pathologist assistant, meaning that they've gone through training, but not the same level as a speech language pathologist who has gone through a master's level program. An assistant will have sometimes gone through a bachelor's program in speech language pathology, but not a master's program. So you want to inquire about what their credentials are.
Well, I'll get to your question in a second, Vi, but I want to know, so when we put together some materials for our special needs planning stuff that I typically do, we put together a series of questions. Is there some things that we could sort of ask a speech person, and if they answer wrong, we sort of know that they're probably not a good fit? Or should we try to find a speech and language person who has a specialty in our child's deficiency?
Sure, I think that's a great question, and I go back and forth with that because, and I'll tell you why. So you can search for a particular specialist, right? That doesn't necessarily mean that that person is a good fit for you and your family and your child, right? So, for example, I worked with a world-renowned autism lab with one of the top autism researchers on the planet, right? So, but when families would come, they're not getting that person. They're getting an undergraduate student or a graduate student who's training, right? So, I think sometimes you want to make sure that the direct person you're working with is a good fit. And really beyond that they are proactive in responding to your child's needs. And so while the credentials are important, and I would, stress kind of looking at the credentials as a bare minimum, you really want to make sure the proof is in the pudding, which is in what the child is doing, how their response to intervention is going. And so that's what you ultimately want to look for. Okay.
And Valerie, I'm going to get to your question now. Valerie would like to know any other favorite resources for addressing specific deficits common in people with autism.
Resources specific to autism is this from a parent or from a professional?
I don't know if Valerie is a professional or a parent, but she's knowledgeable, so I'm assuming she's an SLP.
Sure. So for autism...
Wait, hold on. Not that parents aren't knowledgeable. I'm sorry, parents.
Sure. So I find ASHA's website is one of the most useful sites that you can have. So if you just look at asha.org, you can search within that site for autism-specific services, autism-specific approaches to intervention. And so that's really the catch-all for our profession. They have a wealth of resources listed there that will include kind of the latest studies, the latest peer-reviewed, kind of what's happening in terms of the best approaches to intervention. They'll have a summary of all the different types of intervention. That's really the best place that I would refer people, and that would be for parents or for professionals.
I haven't been there in a long time. Okay, Belinda, we're getting to the hour, so I want to make sure we're wrapping up. Would you like to summarize with anything or last bits of wisdom? I'd like to say something before we go. Can you mute your second for just a second?
Oh, sure.
So I don't have the echo. As I'm saying this from a personal experience, that this has been tremendous for my son. I just am amazed at how well he's done over the last several years, working with his school sites, SLPs, and working with Belinda. And together it's all congealed to have him be so much more verbal. So look into this if it's something you think might be a good fit for you, because it's really, really helpful. If you're in California, you can contract with Belinda directly. I give her a double thumbs up. So, all right.
I just put, I'm going to put this, I put a little note in the chat as well. Someone asked what ASHA stood for, so just put that in there again. And then the ASHA.org is the site for resources.
Excellent. Well, everybody, we're going to go ahead and wrap up. Thank you all for joining us today. And I'll be doing more of these off special needs planning kinds of webinars because there's so much more information that as parents need to know. So Belinda's been such tremendous for us. I wanted to let you guys become aware of her as well. So thank you guys all for joining us, and we'll see you guys, some of you next week. We'll see you guys end of this month. Thank you, everybody. Bye.
Thank you. Appreciate it. Thank you.